How healthcare is being damaged by employee turnover. Recent research shows that over 2/3 of nursing shifts are understaffed. And this is resulting to some serious downstream costs to the organization. Number one, you have to pay more overtime. 80% of the cases to fill these gaps or to attempt to fill these gaps in these understaffed shifts is to simply pay the nurses overtime from other shifts to come and fill in. And we know that when you have overtime, you have to pay time and a half. And ends up being around $133 an hour to pay a nurse overtime. And when you add all this up for an average of 9 hours of overtime a week across the whole year, it's over $62,000 of overtime per nurse. If you multiply that times, say, 15 nurses, you get just over $900,000 of overtime dollars per year. Now, what's interesting to think about too is when you're doing all this overtime work, are you getting better health care? They start to reach the point of disengagement or compassion fatigue, and disengaged employees we know are 2.5 times more likely to quit. Now, let's take the same population of 15 nurses that we're talking about paying overtime to and assume that we lose 3 of them throughout the year. 15% turnover rate. You multiply that times the average cost of turnover per employee, which is $235,000, you're adding another $700,000. So $900,000 plus the $700,000, we're looking at a bottom line impact of employee turnover of $1.5 million across a population of just 15 nurses. So you can see how this quickly starts to add up in healthcare, and this adds more cost. It doesn't necessarily always get better health outcomes, which is the whole point anyway. So for your organization, start to think about calculating your cost of turnover first. And once you understand what that is, you can go plan strategy, a proactive strategy to go about reducing it and also creating less burnout in your nursing population and getting better outcomes for your patients.